Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Well, welcome to another episode of Creative Caregiving and Beyond. Today we have a special guest, Cheray Scott, and she's with InsureWise, which Cheray is going to tell us all about and get us up to speed on Medicare and all things Medicare related to Medicare premiums, how to pick a plan. I mean, it's so convoluted, and even as a lawyer, I have no idea what's going on with this.
It
and
can
I've had
be.
many conversations every year and still trying to understand it when I talk to my clients, and as well as picking a plan for my mom. I'm like,
Right.
It's almost like rolling the dice, like, well, I'll pick that one.
No, and that's why it's good to have these conversations so that, I want to make sure people are educated, that there's some clarity given, because there are some things out there that are confusing people.
Yes.
And then also, I want to make sure that people understand that I'm here as an advocate. Clients don't pay me. I'm paid by the insurance companies.
Okay.
So there's no fee for me to help them based on their situation and things like that. But I want to thank you for bringing me on as a guest today. I'm just so excited.
Well, thank you for coming on, because it's a continuing question, and it's so confusing because there's so many different advertisements out there, and everywhere you go, on TV as well as you go to the pharmacy, and you just don't know what the right plan is, and I get that question a lot. But before we go there, I want you to give us a little information about your background.
Okay, great.
Yeah.
Well, so after college and everything, I was trying to find my niche.
Okay.
It just so happened that in finding a particular job that I started at, the lady who was interviewing me didn't have openings in commercial, but she had openings in Medicare. And I said, I don't know if I want to do that. And she said, well, that's where we have openings. So that kind of condensed the story. But it turned out that I got in it and I loved it. I was in inside sales for 2 years.
Okay.
And also then moved to outside sales and just going out and seeing clients and helping them. I've had my license for 28 years.
Wow.
I did insurance for 11 or 12 years.
Okay.
At one time, I kind of wanted to go and try something different. So I did do medical sales, where I met you one time.
Yes.
When I did home health for years, and then also became a mentor trainer for Girling Healthcare when I left one company. And then I kind of moved around in that healthcare space for about 13 years. And then I started feeling like, I really loved what I did when my first career.
Yes.
And I found myself, found a way to get back to it. So now I do it for myself, and I bring that I've come full circle. Because I started with it. I went into healthcare, and I was able to see how it works or what doesn't work in some of the plans out in the different areas. Yeah. I also did hospice, so I've worked in all of the different arenas. And then so coming back, I feel like between my years of experience and then my culmination of what I did in DFW, I can give a little bit more insight to my clients when I'm giving them advice. So
very good, very good.
Yeah.
I love that you said you've seen what works and what doesn't work.
Yes.
And that makes a difference in anyone's career. When you've been there not only long enough, but you've seen the other end of it. You've seen people who are, because I get clients a lot, and they'll say, well, I've got the best insurance, and I was like, well, you never really know what you have until you use it.
Right.
And so then you really get a chance to see what it will do.
Right.
But it's important to know to be able to avoid those pitfalls.
Exactly.
Yeah.
Exactly. Yeah. And if I may add, what may be right for someone today might not be right for them the next year or the next year, because we're aging, we're growing, we're changing. Yes. We all are. Yes. So for example, there are plans out there that if someone who is healthy all of a sudden has diabetes or some heart problems, there are chronic needs plans that are available for someone who may not have had that before. Both of them are zero premium because Medicare pays. But now if you've got another chronic need, it's called a chronic needs plan.
Okay.
Someone who might have been on a plan for years that was working for them because their health has changed.
Right.
And I do see people who say that, I'm fine. And then I'll say, well, you mind if I ask you some questions? And honestly, it's probably about 75 to 80% of the people that I can see that their life has changed, their health has changed.
Yes.
And so they're qualifying for something else because the market keeps changing too.
That's true.
And they've added, this plan just came in 2022. It came in 2021.
Okay. Okay. So
But
I bet
there are
you've
other
seen a lot
ones.
of changes over 28 years.
I have.
This industry.
Yes, and actually, I think honestly, more of them are positive than the negative we hear about. I mean, there were times when the policies had low to no cost, but a lot of them are no cost.
Okay.
Co-payments for doctors used to be low. Now a lot of them are zero for your primary, and so the co-payments have gone down. The things they add, there's extra things that are added into many of the Medicare Advantage plans. Now, of course, supplements are still an option for people who want that, and that's another. I mean, when people say what's right for me, when I'm doing public speaking with a group,
right?
I refrain from saying that because we can't stand up at a room and say, this is right for you. Right. It's like a doctor coming in and standing at the door and saying, hey, this is your diagnosis. I mean, I'd have to look at the person specifically.
Right.
And their needs and their doctors and their hospitals.
Right.
And then help them understand what's best for them. So best is relative.
Yes.
And a lot of people will ask me that. What's best? It's relative and it's individual.
Yes.
And even a husband and wife. One plan could be good for the husband and another one could be good for Yeah, depending on their situation.
It's not like when you're younger, you work somewhere and everybody's got a group plan. Everybody's lumped into one plan because you're not facing all those medical needs that you would face when you're in your in your retirement years.
Exactly.
So you've got to get something.
There's a lot of options.
Yeah, lots of options there. Well, that's great because this is it's a definite need because the jargon alone is enough to get most people confused. And the difference is, you hear the Advantage plan versus a supplement plan. What's the difference on those?
Well, when Medicare is available to anybody who's worked 10 years, 44 days in the United States, Part A, and Part B they pay for.
Okay.
Now, that price could be depending on what income they made, so Medicare determines that.
Okay.
But when they have Medicare, they have two options.
Okay.
They can buy a supplement, which our parents, that's the only choice. They had a retirement plan or buying a supplement. So that's an option. Or they could take advantage of a Medicare Advantage plan. Medicare supplements have an additional premium, and then you do have to buy a drug plan.
Gotcha.
Versus Advantage plans have no additional premium because their Medicare pays for them each month.
Okay.
So you've got different carriers that have, XYZ, PDQ that have Advantage plans.
Okay.
And even like supplements too.
Yes.
But again, somebody will, well, why would I do this or why would I do that? Well, it's contingent on a person's need.
Okay.
You know, some people, I did meet a gentleman one time, and speaking to him, he told me he was having several surgeries. Like every 2 months he was having a surgery.
Yeah.
Well, that was a person who was better served to be in a supplement because even though he has to pay monthly price,
right,
that's going to turn out to be more cost effective than going at a zero premium. You do pay a co-payment.
Right.
So for him, I said this would be a better fit for you. So it just depends on.
It just depends on the person and what they're going through. Well, I'm so glad we're starting early on this because that open enrollment is what, in October?
Okay, so good question.
Yeah.
Open enrollment, there are different open enrollment periods, or enrollment periods rather. So open enrollment, AEP, is annual election period, and that starts from October 7th, October 15th, and ends December 7th. That's when people are supposed to make a plan change if they want to. Some people say, I'm fine as I am, and they stay as they are. I'll check my clients prior to that each year. We'll figure out, are you happy or you think you want to make changes, or has your health changed? But most people may not know that you have a OEP. We're in OEP right now. So people have a right to make a change between
January. We're in OEP right now.
Right, we're in OEP right now. That's the time to look at the camera. So you've got January until March 31st. That if you picked a plan like that didn't work for you, or you recognize that you have a cancer doctor or something has even changed, and you realize you need a different kind of specialist or a different company, it gives you the right to make a change.
I did not know that. Wow, I'm learning a lot just sitting here.
Yeah.
So there are...
it does end March 31st. And then there's one more thing I want to mention.
Yes.
So if somebody, like if people move, or if they, even from Dallas to Fort Worth, or, or Oklahoma to Texas or whatever, that allows them an SEP, a special election period. So they're allowed to make a move anytime if they move areas. Also, chronic needs plan is year-round because, as we mentioned, you could be fine in January and then in June find out you have diabetes. So now your circumstances change. So you get the right to make a change at SEP because of the chronic need. So there's a little bit of different opportunities when people can make a change. If they retire, of course, they're not locked into the AEP and all that because you might retire in June or July. And when you retire, then you're allowed, because you've gotten your proof of insurance from the company, and you're allowed to make a change because you had insurance, and you transfer to Medicare insurance. So those are the...
That's great to know. I know of instances that are similar in Medicaid. It's just, if you don't know the rules, then you just don't know, and sometimes you're not able to take advantage of those changes, and someone may just continue to have the same insurance plan, but they really needed to change to something else.
They think they're stuck all year. And although when that first came out, I thought, wow, but the way they've created these options, it does give people a chance. And then there's also some companies that are 5-star in DFW, and 5-star is rated by Medicare, and those particular companies allow people to enroll year-round. They can change year-round. Yeah, so if they're on this Apple company and Apple company's just not working out, and I just don't want it, then you can go to this B company because, hey, they are open all year. So that's another election period because they are a 5-star plan. So somebody can get off of one that's not working for them and get on one that is working with that's a 5-star plan. Well, in Dallas.
And someone would really need someone like you to let them know if they even have a 5-star plan.
Well, yeah, and there aren't that many that are 5-star, but Medicare rates them, and there are a lot that are 4, 4.5, sometimes 3. But and there are reasons. I mean, that's a guide to kind of help seniors. Kind of measure. That's not the only measure, but that's there for a reason, and it's typically based on satisfaction rate. The network. The robustness of a network, and just I think they go into other measures. I don't want to say something and misrepresent here, but they've got some good things that they are watching, and it helps people use that as a guide. Besides looking specifically, I can't stress that enough. Looking at your doctors, your specialists, your rehabs. Look at PT, OT, all of those type of things that come when you have other problems that come up in life, like hip or knee surgery.
So are the 5-star and 4-star plans, are they generally more expensive, or it just depends?
When it comes to Medicare Advantage plans, most of them are zero premium because the Medicare A and B pays for the person. So it's not free, but it's zero premium because Medicare's paying.
Gotcha.
If they don't maintain their, A is earned, but if they don't maintain their Part B, they would lose it. But there's no additional premium like there was with a supplement.
Okay. How do they maintain that Part B?
Most people, Social Security, you have options. But like if they're getting Social Security income, they can just have it reduced from Social Security income. But they also have an option to get a bill, to have a direct draft, EFT draft. So they have 3 or 4 options. Or
to make sure they don't lose it.
Yeah. I normally advise people either do it, the direct from Social Security, but then you have some people who are retired that aren't taking their Social Security income yet.
That's true.
And there's reasons for that. If they can wait and they'll get more later. So in that one, I would say maybe do the EFT, because if something does go wrong, at least your premium payments are automatic.
Right.
Yeah.
So when a person's switching from one plan to the next, is that something you assist them with, the entire package of that? I mean, do they have to make calls and tell the old company, well, I'm not going to use you anymore, I'm going to switch to another company?
That's a great question. So when a Medicare Advantage plan, when you're switching from A company to B company, because they're both Medicare Advantage, Medicare just moves and they don't have to make a call. None of that. And when I'm meeting with them, I just get their Medicare, I verify their doctors, and then I do the paperwork and they just sign. So it's very seamless. I mean, and with COVID now, we do a lot of online. I can do the application and send it to them. Or someone's not computer savvy, we can do a tape recording. So I mean, once we go through everything and verify it, I do the application and they just kind of sign or verify yes on a recording. A supplement, they would have to call and say, hey, we need to cancel this because we're no longer paying this premium because we're doing something else.
Okay. Well, that's good to know. That's more seamless, because I can see someone thinking, you know what, that's just too much trouble for me to be on the phone about 2 hours.
No, I'm glad you asked that. No, it honestly, it's one thing I'm grateful. Over the years, that's a change.
Yes.
I used to do paper. I'm old school. I grew up, with the old school. My boss, that was, Bob Bishop, rest his soul. He was another one that was instrumental in my life. But we did the grassroots, go out and do paper and go see people and all this stuff. And when I first got back independent, I told my broker, I'm just going to do paper. And then one day I got to a client's house and I didn't have the right book for what I wanted. I said, we're going to have to do computer. And I saw how seamless it was. I mean, it's easy for me, easier for the customer. It goes right in instantly. And I thought, what am I doing this paper for? I'm just so old school. So I've been in it for almost 30 years. So there's been some change. Some shifts too. So I appreciate those are some of the good shifts.
Yes.
And again, the benefits have come. We'll probably get some of the things that cause people, headaches in a minute, I'm sure.
Well, what's the difference? I'm glad you brought that up. What's the difference between the HMO and the PPO?
Okay.
When someone's deciding what plan to do.
Okay, great.
Components of the
got
plan.
such great questions. So, hopefully this should really, after this, we might really have educated some people here, and that's the goal. That's the goal, because I really believe that I break it down, really simple.
Yes.
So the HMO. Health maintenance organization, you have to use the network.
Okay.
The network, some companies have more of a robust network and some don't. That's why I say it's really important to check that.
Okay.
A PPO, you do have a network, but then you've got flexibility that lets you go out of the network.
Okay.
There are some PPOs are no cost. There are some that have a low premium.
Okay.
And typically you might find they don't have a deductible for medical, but they have a deductible for drugs, where the HMOs a lot of times don't have any deductibles.
Okay.
And so your stop loss is a little higher. Like, for example, sometimes it's almost double as far as what you're paying in co-payments.
Right.
Where there's a stop loss per year.
Right.
The HMO might be one and the PPO is another, and sometimes you will see that's higher.
Okay.
But someone who wants, like if you're living in Dallas and you have a child in Maryland, and you say, I want to be up in Maryland with my grandkids.
Yeah.
And I go there,
And that happens a lot.
Right.
A lot of seniors, they may spend half the year somewhere.
Yeah, they go back and forth or whatever. They go
Yes.
stay with one child, or they go visit for a month. So that PPO allows them to pick a doctor over there.
Okay.
Where the other one, you do stick within the network of Dallas-Fort Worth. Now, I do want to make sure this is clear. Anybody, if you're traveling in the United States in an emergency, is covered on HMO or PPO. So if they have an emergency or if they have an urgent care, they're covered. But if you're staying in Maryland for 4 or 5 months, you may want, Mom, let's pick a doctor here while you're here. So therefore, you have a scheduled appointment. If there's a surgery needed, it's allowed on a PPO. On an HMO, you can't do scheduled surgeries. It has to be an emergency to be out of network.
Gotcha.
Also, sometimes I've found people that care in the DFW area.
Yes.
Sometimes they like cancer centers in Houston. And I've had a client where I was going to move him. And then when I found out his circumstance, I said, it's not good for you to move because you're going to need that PPO so that you can stick with your cancer center and your doctors on the PPO, because he thought he was paying some more in co-payments and he wanted to save some money. And I said, well, no, it's not going to help you because you need that network. So you need to stay with that. It was a regional PPO. So there's different things like that. But those kind of circumstances, you would say, well, although this is a good plan, this doesn't fit you because you need to be out over here in these Houston doctors. And I wouldn't ever do a disservice to anyone with their health.
Exactly.
Right. So there are people I see and I'll say, well, we don't need to change you, or you're fine as you are. I mean, if I talk to them, I will be honest. Either I can help you, or hey, you've got the good plan. Stay as you are.
Yeah.
Maybe we'll talk next year if there's some changes.
Well, so it really is person specific. Exactly to determine what they need. Wow. So if someone's going to sit down with you, what do they need to come to the table with? A list of doctors, or what's important for them to
That's
have
a great
already
thing.
ready for you?
Okay, so definitely you have to have Medicare A and B. Doesn't matter if you're buying a supplement or if you're doing a Medicare Advantage plan.
Okay.
You would have to have your Medicare.
Okay.
And I help people, and I'm willing to help people get, like, if they're just trying to figure out Medicare and they're about to be turning 65 in the next 4 to 6 months, I'll give them the number. This is what you do. Call them, get set up, and then we'll stay in contact. And when you have Medicare, then we can move into your insurance piece. But your Medicare card is what you need. Yes, it's important that people have their doctors and specialists, and even their medications. And I've also, like I think somebody asked me, well, what have I learned? I learned to keep probing and find out that, are you seeing anybody at a rehab? Is there any ancillary places that you're going for testing?
Right.
Because those are good things to double check as well.
Okay.
Because, you don't want to get someone on the plan and think, oh, I've got their primary and, oh, I've got the specialist, but we don't have this ancillary service, and they go for some critical testing every 3 months.
Right.
Those are the it works, and I do the work. So it's not complicated for the client. I mean, they give me the information, and I'll do the checking.
Okay.
And it really seems complicated, but it's not. We've got some great tools. That's the other thing. Technology now, you just click them. Before we used to flip through books. It's a different world.
Encyclopedia over there. Get that yellow pages.
That's right. I grew up with the encyclopedia and the yellow pages, and I grew up with a book of doctors. Well, we don't have that anymore. It's all computer, and it does. The only thing is sometimes technology will play a trick on us and act up, and that's the only hiccup I have when it won't act right. But for the most part. But I can even do it on my cell phone. I mean, that's how wonderful they've made technology.
Very good.
And a lot of seniors today are very savvy, and they are doing, if I do the application and send it to them, they click on the phone, they do it on their laptop, and a lot of people are signing on their phone. They look at their emails through the phone, and they just click, and they find it really easy too. And they go, oh wow, that was seamless. You made this easy. It wasn't that bad. So
great. Well, and that's the thing, I think more people will do it if it is seamless, if it's easy to do versus, oh my gosh, I'm dreading that. I'm going to save that for Monday morning, because it's going to take a few hours to get that done.
If you feel like you're in the trenches by yourself, certainly.
Yeah.
But I'm an advocate. And then I also say, I want to caution seniors from looking at these TV, commercials and looking at these numbers. And I know they've got some great actors that we know from back in the day, and all these neat things that make people nostalgic. And I remember him. I loved him.
Okay,
he said it's good. It's good.
Yeah.
So they start calling. Oh, I can get this and get that. Well, a lot of times the old rule, if it sounds too good to be true, it is. And it's not to say that some of these other plans don't truly offer payback of Part B or a larger dental, but if you look at it under the microscope, you might find that, I get this Part B, but I don't have my specialist, and I don't have ancillary services. I don't have what I need if I get sick, and or the dental sounds good, but then it's a certain network that they use, and dentists that you use are not on it, or maybe dentists you don't want to use. So these are the things I kind of point out to people. It's like, or this plan, has a flat rate on testing, and this one's saying 20% for testing. That's a huge disparity when you have a flat rate versus this one's 20%. But it looked all great in the front because you were getting a bunch of money or something. But then there are some people say, I don't care. I want that extra money, and that's the beauty of it. There's different things for everybody, and so if somebody says that, I go, okay. That's fine, and that's what you want because that money's going to help you, and you just want to have some type of insurance. Yeah. We all have a right to make those choices, so that's the beauty of being a broker now rather than an employee, because I do represent several different companies.
Great. So you don't have to push one particular product. You are showing them a array of different products that can work for them. Whatever works best for them.
Exactly. Yeah. Exactly. Yeah. The ones that are higher rated, of course. It depends. Most people might like that, but at the end of the day, they have the option. It's there, and so that's the beauty of the service. And it really is. By the time I explain Medicare and then explain the options and kind of take ownership of helping them with it, a lot of times I've seen people go, oh my God, I was so worried, and now look, I thought this was so horrible, but you made it better, or this is easier than I thought. It's already done, Yeah.
Well, this is truly a service. It's a wonderful service that you're offering people.
It is,
and because it can be frustrating, just gearing up for it, because it does get a lot of advertisement, and you're wondering, oh my gosh, what to do. So
I really disappointed at some of the ads because people who have their good care sitting home, vulnerable, and they sit there and they make that call, and sometimes it's just not the right, a lot of times it's just not the right. I've seen people where the lady, she was like, I just went to the store and I was just gone 2 hours. And he said, I saw the thing and it had all these wonderful things. And so I just called. And then she said, hey, he messed up. And then he said, oh, you can get this too. And she said, oh, no, I'm not leaving my good insurance. This is a true story. They're so enjoyable. I really enjoy my clients. They're really enjoyable. So then, it's kind of like a sitcom,
Yeah, it really is, isn't it? It really is.
So So the sad part was, then he said, but then my specialists weren't on and I couldn't get this medicine. And and so I felt my heart went out to them because he's worried, and then she's worried too because she knows his coverage is substandard.
Right.
So it feels so wonderful to be able to help them and get them back in line. Okay, well, you were on this plan and this was your best plan. You kind of fell for the okie doke.
Yes.
Don't worry about it. We'll get you taken care of. So there's a lot of that cleanup going on.
Wow.
I have doctors that I partner with from when I did medical sales that also give up my cards to help educate the clients because it takes it off of their plate. And they'll say, Cheray, somebody got moved off of, she's out of another plan and she doesn't have, I'm not even on that plan. Can we get this straightened out so I can see my client?
Right.
Yeah.
That's wonderful. Yeah. That's wonderful. You can come in there and help with that. Gosh. Well, I've experienced that to a certain degree with my mom with the donut hole thing. I've heard about it from a lot of clients before, and then with the medicine, and it's like, what? You get this big bill. Like, where'd this come from?
Yeah.
And how do you know when you get there? You don't know that you're there until you're there, and then you pay this bill.
Well, every year the numbers change, and so I don't even want to quote it because I could be a little wrong. There's a certain amount. I believe it's I don't want to make a mistake here, but it's around a little over $4,000.
Okay.
That what you pay and what the company pays towards the drug. So if the drug is $100 and you pay $10 copayment, that $90 difference is still going towards that increment. See, that's where people get confused. And once it gets to that level, and every year they've changed it, which is why, sorry, I don't remember the number right now. But when you get to that donut hole, that point in the middle, you have to pay 100% yourself.
Right, like you're on your own. Yeah.
And then once you get to I think it's about 66,000 or something, then you're on the catastrophic side and you pay 5% or whatever's less.
Okay.
So there is a time in the middle. What I encourage people to do, I mean, of course, none of the plans are making anybody take a generic drug or making anybody take a certain drug. But it is a good discussion, a conversation to have with your doctor.
I was wondering, can you do that? Can you supplement to a different, you can ask for, is there another drug that's generic that may be less expensive?
Exactly, or not even generic, even name brand that may be less expensive. I would say we all need to be, all of us need to be better advocates over our health and have the dialogues with our doctors. Say, I'm on this plan, and this medicine is really expensive. Do you see another medicine in here? It doesn't have to be generic. It could be generic or name brand.
Right.
And that could work for me. That would be less expensive because this is tough on me.
Yeah.
And a lot of doctors will work with clients. And if they even have samples, sometimes they give samples. So, I mean, I'm not saying that's always. I don't want to, but they do. A lot of the doctors and caregivers I've been partnered with or worked with and seen, they're very, very caring and they do whatever they can.
Yes.
But sometimes if they don't realize or they don't know, you have to have the dialogue to kind of say, okay, I didn't realize, or hey, you know what, we can play with this and maybe you can do this diabetic medicine versus this diabetic medicine.
Right.
Like there are plans that have low, like even name brand drugs that have a ceiling of only $35, but you have to, there's an asterisk of the certain drugs that are covered, name brand and generic, that have that cap.
Okay.
So, and you could say, Doc, can I use this? Or, and I encourage people to talk to their doctor and see, and then I said, I'm not saying you have to, but it's a good conversation, and it might, if you're willing to try it, you can try it. If it works, great. If it doesn't, then at least you tried.
You tried. So when a person sits down with you, is that something you can sort of project out if you see their medications, what it would look like, and if they would reach that donut hole? I know a lot of typically, I don't know if medications, the prices vary throughout the year, or are they pretty locked in with Medicare?
When you have the drug plan, like if you buy a supplement and an individual drug plan, or if you're an Advantage plan, which has the drug plan included, all that's included at no additional cost. The drugs come out each year, and they have a formulary in the back of most books. Now, they do still have that. And you can find, Tier 1, Tier 2, Tier 3, 4, and 5. Tier 1 and 2 are normally the generic. 1 is preferred generic, then regular generic. Then 3, you might be at the beginning of name brand, preferred name brand. Then 4 and 5 typically become specialty drugs. So I can help look at the drug and then say, hey, this is Tier 1, this is Tier 2, this is your copayment for this. This is your and so, and I encourage people to, if you can, take advantage of the mail order, because a lot of times you save money that way, and also time. I mean, who's who's got time
if you can come
to go to
straight
the
to
pharmacy
you.
and sit and wait, and the gas prices are high? I mean, this, the convenience of, and now a lot of plans are not just even doing 90 days. A lot of them are doing 100 days that give you that little cushion past the 90 days so that if you needed to order again. But once you get it done and you tell your doctor, that can be pretty systematic too, that medicine's just coming in to you
on time.
And you get and it comes up cheaper out of your pocket, a better value. With the different tiers. So I can give people an idea, well, this is tier 1, this is tier 2, so that's your co-payment here, that's your co-payment here. That's how we kind of give them an idea of what they're going to spend. Now, the donut hole part, I can't always promise. I don't really know the real costs.
Right.
So I can't really promise that part.
Yeah.
I've had some clients call me back and go, oh my gosh, this is what's going on. And then I get in the trenches with them and say, okay, let's call your, the 90-day drug company, and let's look at this. And then sometimes they even give me ideas of alternatives for them to ask their doctors.
Oh, very
good. And again,
very good.
These, I always try to be careful. Like, I am not a doctor. I'm not trying to practice medicine.
Right.
I'm just trying to help you look at alternatives that can help you.
Right.
And
exactly.
I make that really clear.
Yeah.
But it has worked. Because to your point, there are some people who never catch the donut hole, but people who do, that is a conversation that comes up. And it's always like, oh my gosh, I hit it in June. And I hate that. We can't change, because it doesn't matter if it's a supplement with a drug plan or a Medicare Advantage plan. Those drug plans are regulated. So that donut hole is it's a regulated thing, and that's the way it is.
That's just the way it works.
Like Roger Cronkite used to just say years ago, that's the way it is.
It's just the way it is.
Yeah, we'll see what happens if they change it in the future, but today and right now.
Okay, okay. So what tips would you give our audience as they look at the upcoming enrollment or in the middle of one enrollment right now? What tips or just generally would you give?
Well, I keep going back to, I can't impress upon anyone enough, checking your doctors, your specialists, the network, it's a huge thing. And even, sadly to say, you'll have people who seem like they're the poster card of health today.
Yeah.
But then 6 months later, something goes on.
That's true.
So, looking at what that company really offers as far as the doctor, specialist, ancillary services, your co-payments, I really help them see. Look at what you would pay if you had to do an MRI. Look at what you have to do if you have to do labs or x-rays or CT scans. Look at those type of things, because we may be in picture of health today, but there's no crystal ball. Right. None of us know. So if you're getting a plan, even if they're no cost, no cost doesn't mean they're all equal.
Well, that's true.
So we get there and I help educate them to see, what this offers versus this offers. And if someone says, oh, I really want this, that's great, but I will also still make sure that I have a comparative tool. Okay. And I also, of course, my experience in knowing, I'll help them see, or I may have both books and say, look at this, let me show you this.
Okay.
So this is what you're looking at. That may seem primary, but that is a huge thing.
It is really a huge thing.
Because when people get a plan and they don't have their specialist, or they get sick and they can't get a specialist,
right?
Or even it's good to remember, if you get diabetes or heart problem, you can make a shift to another plan year round.
Okay.
There's 5-star plans. So if you find yourself in that debacle, there's other options. That doesn't mean you have to wait.
You're not totally locked in. Yes. That's great.
That is. I think that's a game changer.
Yeah.
Because when you have those options available, and people being aware and knowing, that they have these options, they can do it or not, but at least they're aware.
Right. Exactly.
They're not stuck.
Exactly. Exactly. Well, the bottom line is we all need your help. It's a good idea to definitely get in contact with Cheray for a consultation, and don't wait till the last minute. Get all your questions answered. And Cheray, if someone wanted to get in contact with you, how would they go about doing that?
Yeah, the probably the easiest way is to text or call me.
Okay.
And my number is 214-518-4307. So that's 214-518-4307. And I think that's probably easier than emailing.
Yes.
But I'm texting works a lot. If I'm in some place, I can get the message, or I'll call and leave a message. But definitely, I'm happy to help anybody. There's still time if somebody's in a wrong plan, or they found it they're in a debacle, I can help them. Or even look at their plan and say, hey, you're fine. And that just gives you peace of mind.
Yes.
Peace of mind is always good, too.
Yes, it is. Yes, it is. So there is help to the rescue here. So Cheray is here to help and answer any questions and make sure you're in the right plan. So we're definitely going to be talking for my mom as well as the rest of the seniors in my family. It just, makes a difference.
Yes.
It really does. So thank you for your services and all you do for the senior community.
Well, thank you. I mean, it's such a joy. That community is just, I kind of left the corporate world to kind of come back and do this, and I don't really feel like I'm working. I feel like I'm doing my passion, and I've had clients sometimes tell me that, like, you're working in your passion. I do enjoy it.
Well, I can tell just with this interview. I mean, you're passionate about it. You're very knowledgeable.
Thank you.
My goodness, yeah. Well, thank you for coming on the show.
Well, thank you for having me. I really appreciate that.
And again, reach out to Cheray and make sure you get the right plan for your loved one, family member, or for yourself. And make sure you like us and subscribe to our channel. And thanks for watching another episode of Creative Caregiving and Beyond.